Professor Hänninen, thank you very much that you agreed to give an interview on this Congress of Clinical Environmental Medicine, Oncology, where you gave a lecture yesterday, a very interesting lecture. And you are the expert in population exposure and public health risk assessment. By this, I would like to ask you, why was the risk assessment and risk management in the past, and still is, more or less only based on scientific research from faculties toxicology and hygiene and public health? Their evaluation and decision over health and mobility still lean on the old scientific approach of reductionism. Due to the mono and linear causal scientific approach insisting on the dose effect relationship, still is not able to be aware of complexity in chronic multisystem illnesses associated to the environment. This leads to an unnaturally and unnecessary harm to people and makes it impossible to start primary prevention early and effectively enough. Considering these facts, do you see any upcoming switch in your country, Finland, and in Europe? In the future awareness of those illnesses by the mainstream science and the health system? And do you see any switch in the political risk assessment and risk management?
Thank you, Dr. Onsorge. Thank you for the opportunity to participate in the interview too, and the important questions that you are bringing forward. From my point of view, the public health significance of different risk factors is a central topic. We are trying to quantify burden of disease from different factors. And as I see, related to your question of the future, is we already currently have a big disparity between what is acknowledged as a big risk on statistical basis, on a mechanistic and causality basis. We know big risks that are related, for example, to alcohol consumption, tobacco smoking, or if we come to the environment, particulate matter, fine particles that we are breathing every day. They are posing big risks, but these risks are not fully acknowledged in the mind of the population. But if you look at the future of for example, multi-chemical sensitivity and multiple problems, I think that they are receiving quite a lot of public interest in the media, and also the patient organizations and individuals who are affected by these problems. They are getting a lot of space in the media and in the public discussion. So in that sense, I would be optimistic in the sense that we are moving forward. But as we discussed with you already yesterday about the complexity and the scientific problems in establishing the assessment and treatment procedures for this type of complex issues, I don't believe that there will be any quick solution to this problem.
Of course not. The same subject, question the switch, future medical education, that young doctors see this at universities, this education on universities for students and postgraduate for physicians concerning those matters generally, as well as diagnose, therapy and prevention of those illnesses for individuals especially. Do you see any horizon upcoming behind the horizon that this could be introduced in universities in postgraduate education for physicians?
This is a very important question. I'm happy that you bring this up, because I'm very worried about the capability of the medical community to react to these environmental health problems where we have difficulties in measuring the exposures, we have difficulties in measuring the disease, and we have difficulties making the diagnosis of these diseases. So in that sense, it's a burning question, and I would be very very happy to see that in the training of medical doctors, it would get more attention to make the doctor to treat the patient as a whole and to take into account all the different factors that are affecting the well-being, and not only using laboratory tests, evidence-based medicine methods to search for specific problems that that doctor can easily treat, for which we have the ready answers. But how to take this further in the development of medical training at the universities is of course a difficult and large question. I think that the work that is done by the German societies working in this field is very important, and the European Academy of Environmental Medicine is making good progress in developing the methods, even though there is still a lot of work to do. And maybe from point of view of coming from Finland, to strengthen the international collaboration, international aspect, to allow also for participation from other countries is something that we would like very much to see coming forward.
Thank you.